So I want to talk a little bit about accelerating healthcare technology in Oregon, and I want to tell you a story. And that story is going to start with a report that we've been working on for the last 10 months. Now, the background to that actually has to do with two individuals, many of you know, Dennis and Frank, of Curadite and Health Staff. And they are both entrepreneurs who came across this problem in developing products. And the problem is, how do we do this if we don't have money? And how do we get money if we haven't done this yet? So let me give you a little background on where this insight led. They started first with the Digital Health Collaborative and then changed it to the Health Technology Collaborative. And the background of this was to create an inventor space that was focused around providing the tools specific to the health technology field. They eventually, this year, became the Health Technology Collaborative, an applicant for a 501c3. We are located in Beaverton, Oregon, brought on Steve Thompson, who's also part of the collaborative, and myself. And we applied for and received a grant. Now, when you get a grant from the HIOP grant, the fun part about it is that you get the grant about the time that you have to start. So it's a huge scramble to start enacting it. I want to tell you three things today. The study, so you have an idea of what the study will look like when you read the report, because at the end I'll tell you how to get it. I also want to tell you about the outcomes, so you can have an idea of what to expect. And then I want to tell you a little bit about some of the opportunities that came about. First thing we had to do was to put together a team. Some of who are in this room, raise your hand if you were involved in the project. We have a few people here. Put together a team that were very diverse, from health technology to economic backgrounds, to researchers, designers, a lot of people working on this. And the idea would be to use a whole variety of methods so that we're triangulating on the inside. Because when you ask a question in research, you don't want a yes-no answer. What you want is a if not, then what answer. That enables you to take those funds and actually do something useful. So remember, we said the study is going to be about the inventor space, but the context is our health technology sector, the community of health tech people here in Oregon. Us. First thing is measuring. So the entire study was designed to say, what are the things that we need to know? What are the things that we can measure? And then to involve people like Pat Scruggs, to involve people like Pinnacle, that we can get some tracking mechanisms for measuring the outcomes of our studies. So let's talk about the outcomes. When you put a study like this together, obviously you have a lot of different perspectives. What we want to do is design the study as a team. So we go very broad, with a large number of data points from surveys and so forth, and then very deep with deep in-person interviews, or an IDI, in-depth interview. These are usually about an hour. Our target was, as you saw earlier, about 35. We exceeded that by about 50 to 60%. The first insight was that these sector-specific inventor spaces would be very relevant. Right? Overwhelmingly, the data showed, as we hoped it would, that the intersection of the tools and the ability to do it would lead to an organization that would be useful, much like Otrati was very effective and has been very effective and is very effective in the life sciences. We organized it around 5 different pillars. One is to create knowledge, to create tools, and then to connect. But the other thing that came out as an insight was that Oregon has an abundance of disconnected assets. In other words, you can go to Otrati and get this tool. You can go to PI and get that tool. You can go to TAO and get knowledge. There's all of these great organizations. So what's the real opportunity beyond what we were hoping to find about the Health Technology Collaborative? Well, the real opportunity is to explore what is our community of collaboration here in Oregon. Like, what is our connective tissue? Because we all know each other. Most of us here, we're probably 1 or 2 degrees of separation from each other. We know each other, we like each other, we have drinks together, but there's still this barrier, right? Very much like, I don't know the cost of my broken foot. I also don't know the cost. If I thought about it, how much does it cost to join this organization, that one, use the microscopes at OHSU, use the 3D printer over at this organization? You have to join every single one of them. So the idea is this innovation currency. We're going to have a report. You're going to be able to read the proposal that we have for creating a currency that will allow us all to connect in a way that we can accelerate and meet all of our goals as a community. Thank you very much for your time.
Thank you, Austin.